Autism Spectrum Disorder is a neurodevelopmental disorder that affects the functioning of the brain. Autism is considered a spectrum disorder because there is wide variation in the type and severity of symptoms people experience. Some students with ASD may behave in ways that teachers find challenging to manage. It's important to stress that ASD itself does not cause challenging behaviors. Rather, challenging behaviors are a common reaction from students with ASD when faced with demands that outweigh their skills. The student uses challenging behaviors to communicate something. We need to help them by trying to understand the meaning behind their actions and teaching them more effective ways to communicate their thoughts, feelings, wants, and needs. ASD is characterized by difficulties in two domains: restricted repetitive pattern of behavior, interest, or activities, and social communication and social interaction. Some of the common restricted repetitive patterns of behavior, interests, or activities include stereotyped or repetitive body movements, use of objects or speech, insistence on sameness and rigid routines for daily activities, difficulties with dealing with changes to routines or environment or transitioning between activities or places, persistent preoccupation with an interest and obsession that is abnormal in intensity or focus, and undersensitivity or oversensitivity to sensory input or unusual interest in sensory aspects of the environment. Some of the common social communication and social interaction impairment symptoms include difficulties processing and understanding language, especially abstract or complex language, difficulties with understanding and using appropriate eye gaze, voice, facial expressions, and body language, difficulties or failure to initiate, respond to, sustain, or end social interactions, difficulties or failure in forming, sustaining, and understanding friendships, difficulties expressing feelings or needs, lack of interest in other people, and difficulty in sharing interests, activities, and achievement with others, and delayed language and speech development. Some individuals with ASD may have accompanying impairments such as an intellectual disability, language impairment, gastrointestinal problems, seizure disorders, eating and drinking issues, sleep disorders, anxiety disorder, depression, obsessive compulsive disorder, bipolar disorder, and schizophrenia. The number of children of all ages being diagnosed with autism spectrum disorder continues to rise. Greater awareness, recognitions, and changes in diagnostic criteria has resulted in more children being assessed and diagnosed with autism. So it's reasonable to expect that educators will encounter students with autism in childcare centers and schools. Although it's a lifelong disorder, there are a number of strategies, supports, and services that can improve an individual's quality of life. The Behaviour Help course, Positive Behavior Support for Students with Autism Spectrum Disorder, will equip you with a toolkit of practical strategies to assess, manage, and prevent challenging behaviors in children and adolescents with autism spectrum disorder to create an environment that supports their unique needs. You can help them, and Behaviour Help can help you. Enroll now.